Hi, and welcome back. Eczema is one of the most common skin diseases in the world. A lot of babies, children and adults suffer from eczema, and sometimes it can be difficult to treat it effectively. In this video, I am going to talk about how eczema presents, what the risk factors are and how it can be treated effectively. Please don't forget to like and share this video. It can help other people around you with this condition. Eczema is an inflammatory skin condition that makes the skin itchy, dry and cracked. There can be scaly or thickened patches, red, crusty areas, blisters and skin infections. Eczema is also called atopic dermatitis. It is most common in young children, but it can affect people of all ages. The symptoms usually start in babies and young children and tend to get better as they grow older. Eczema can affect different parts of the body, but it appears more commonly on the elbows, knees and hands. In babies and toddlers, it is also common on the face. The exact cause of eczema is not fully understood. Eczema often happens in people who have allergies, and it can be related to asthma and hay fever. It can also run in families. Certain things can make eczema worse or cause flare-ups. These include allergens and irritants like soap and washing detergent, pets, pollen, house dust mites, some fabrics, and certain foods. Stress, temperature changes, skin infections, and hormonal changes can also aggravate eczema. It should be noted that eczema is not contagious, so it cannot be spread or caught from someone else. There is currently no cure for eczema, but the symptoms can be managed well with various treatments and measures. The treatments for eczema consist of emollients, topical steroids, and antihistamines. Emollient is a medical term for moisturizer, and it can come in the form of cream, ointment and lotion. For common and uncomplicated eczema, topical emollients can be applied to the affected areas. Aveeno, Oilatum, Epiderm or E45 eczema relief are among commonly used options. A topical steroid medication like hydrocortisone cream, lotion or gel can be used to treat eczema. Steroid cream should not be used for more than 7 days at a time as it can thin the skin, unless this has been recommended by a doctor. An antihistamine such as chlorphenamine, loratadine or cetirizine may also be beneficial to help with the symptoms of eczema, particularly if there is itching or irritation. For more severe eczema, there are other treatments such as tacrolimus ointment, pimecrolimus cream, or special dressings. There are some things that can be done to help manage the symptoms of eczema. It is advisable to avoid allergens and irritants that make eczema worse, to apply emollients frequently, to wash with an emollient instead of soap, and to keep the skin cool. The emollient can be used up to 4 times a day during flare-ups. It can be used when the skin feels dry, and at nappy change in babies. Emollient should be applied in the direction of hair growth and not rubbed in. Emollient can be continued during and after steroid treatment. A weak dose of hydrocortisone cream once daily may be considered for eczema on the eyelids and periorbital area, which is the area around the eyes. Oral steroids for more severe cases or flare-ups of eczema can be prescribed by a doctor for a very short term. For recurrent infected eczema, chlorhexidine containing emollients and bleach baths once or twice a week can help. Specialized treatments of eczema are available, and these include cyclosporin, azathioprine, mycophenolate, and methotrexate. There are also newer treatments for eczema, and these are JAK inhibitors and biologic dupilumab. It should be noted that these treatments can only be prescribed by a dermatology specialist and only if the conventional treatments do not work. If conventional treatments and measures fail to control eczema, it is recommended to see a doctor or dermatologist for further assessment. If eczema is blistered, crusty, leaking fluid or pus, if the skin is painful and swollen, if it suddenly gets worse, or if there is high temperature, it is also advisable to see a doctor in person as these can indicate that eczema is infected. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.